moving on, and how do we have and provide this emergency care planning, integrating care for children? And so the next slide is, thinking about the toolkits. We're going to share some resources here. And I think back to the very beginning of our training here, a lot of you mentioned one of the things that you wanted to get out of this were resources. And so we're going to share some here today. I also, have a lot of children in my practice, and we're part of a work group in Pennsylvania around home nursing. And I just think for children and families that have nursing in the home, I just think it's important. I wanted to do a shout out here that they're an important part of that team. So we have to remember to include them on the training of the emergency plan, as well as educational providers, thinking about creating that support network and sharing information, talking about the go bags and these emergency supply kits, which we're going to talk about, thinking about extra supplies and food for not just the child with special healthcare need, but the entire family, and also even thinking about pets. So I always think about integrated care planning and the key elements of that. And I think about just having that care plan and that information being accessible. I always say that it's a living and breathing, meaning that it's really kind of moving, and it needs to be updated. And that care planning, medications change, needs change. And one of the most important things in all this are family goals. Understanding what the family and the youth and what their goals are, what their needs are, is critical. And so really those key elements, kind of creating that network and having that care plan that can be shared across systems, the medical system, the emergency system, the educational system, where many of our children and youth spend a lot of their time, as well as recreation, home nursing. So you think back to that slide that I had earlier with the neighborhood and all the different places that permit interfaces, it's important to think about those traversing all of those sectors. I want to transition over to a video with my colleague and mentor on the next slide, Dr. Esther Chernak, who's the director of the Center for Public Health Readiness and Communication. You can start the video. Thank you.
Hello, my name is Dr. Esther Chernak. I'm the director of the Center for Public Health Readiness and Communication at the Drexel University Dornsife School of Public Health. And I'm pleased today to share with you some tools that we developed for families with children with special healthcare challenges, with the goal of helping them prepare for disasters. And these are tools that we developed after a research study that we completed that was funded by the Centers for Disease Control and Prevention. Thank you so much for letting us share our toolkit with you this morning. The Center for Public Health Readiness and Communication at Drexel University Dornsife School of Public Health recently completed a series of checklists and planning guides for families with children with special healthcare challenges. We interviewed and surveyed several hundred families to see what information they needed to prepare for disasters. And we also asked them from whom they wanted to receive this information and how they preferred to receive it. We learned that families want information that is tailored to their child, specifically taking into account their child's medical conditions. And they prefer to receive information like this from someone who knows their child, most of all, their child's doctor or another healthcare professional who knows their child. And finally, they wanted easy to read, succinct, and focused information that contained essential and important elements that they needed to know to prepare for emergencies. We took this information and reviewed all the emergency preparedness guidelines that was available, both for the general population and for children with special healthcare challenges, and created a number of different tools, shared them with families and healthcare providers, and revised them based on the input we got after we shared those tools with them. So what I'll do in the next few minutes is demonstrate to you the different tools that we've developed with the goal that families will see these directly, but that pediatric practices and other healthcare professionals and first responders can also use them to share with families and help them prepare for emergencies and disasters. The first fact sheet that I'll share with you is a fact sheet that we developed for families who have children who have physical disabilities, which is to say families who have children who rely on durable medical equipment or who have access and mobility challenges. And you can see here we have just a 2-page form where we encompass some key planning steps for families with special healthcare challenges, completing an emergency information form with all of the child's medical conditions and needs and medication lists and equipment needs, And we suggest that people work with their doctor to fill out the emergency information form and update it every year. This way, if a child has to relocate or see a provider who isn't normally familiar with their medical conditions, all of the information they need is there on one page. We give information around what supplies a family will need to gather in an emergency, a kit or go bag, and we give recommendations for creating a family communication plan. The bottom part of the first page is information about how families whose children rely on durable medical equipment should plan for power outages, particularly if they have equipment that needs power. And we give information also about just how to evacuate a child with physical disabilities, how to make a go bag of supplies in case you have to leave your home urgently or families have to leave their home urgently. And also information about how to deal with stress and the mental trauma that often comes with emergencies, how to help your child cope. We recommend also that families review this kind of content with their doctor and other healthcare professionals in their lives, because they can also get a lot of good information from the pediatrician's office and other professionals in that office, including first responders, about what they need to do to be safe in an emergency. The autism spectrum may have challenges communicating in emergencies, so we put together some simple and important tips that families can use and first responders and pediatricians can use to help children on the spectrum and children with other intellectual disabilities communicate during emergencies. We gave recommendations for how to be ready for a power outage or an evacuation. We know that children on spectrum and children with intellectual disabilities often rely on many different devices to help them communicate. And so it's an important thing to know how to be ready in the event of a power outage or utility disruption. Again, recommendations for helping children cope around emergencies and disasters as well. And I should note that on all these forms, we encourage pediatricians to use them and other people in the pediatric practice and first responders as well to use these forms to help families prepare for emergencies. And there's room on these forms that you can put your own information on, in terms of how to contact your own practice or your own organization or agency, if that would be helpful. And finally, in the same vein, we have a similar set of recommendations, a checklist for families who have children with either hearing or vision impairment. Again, general planning steps, recommendations for communicating during emergencies, planning for power outages or an evacuation if the family has to leave their home urgently, and recommendations for helping their child cope. In addition to these three preparedness checklists, we also developed some additional recommendations and tools for families that we thought would be helpful. We heard from families with children with special healthcare challenges that if they ever had to leave their home to go to an emergency evacuation shelter, for example, if there was to be a fire or a flood in their house, they had lots of questions about where the shelters would be located, what would be there, whether the shelters would be equipped for children with medical challenges. So we put together a one-page fact sheet, both for pediatric offices, but also for public health and emergency management agencies, as well as first responders, to share with families with special healthcare challenges related to what they can expect at an emergency evacuation shelter, what will be there, what won't be there, and what they should bring if they ever need to go to an emergency evacuation shelter. In addition to this fact sheet, we also developed a checklist, a one-page checklist for pediatric practices, as well as other healthcare providers, with respect that addresses how to help patients with special healthcare needs prepare for emergencies. And this checklist includes things like making sure your practice or organization is prepared for emergencies with just some very basic information around utility outage planning, continuity of operations plans, communication, but also give some pointers for how healthcare professionals and pediatric practices and other organizations can help their families with special healthcare needs prepare for emergencies when they visit their office. And that is everything from working with families to make sure they have their own plans for emergencies, making sure families have a completed and up-to-date emergency information form, and also setting expectations for how the practice or agency will communicate with the family during an emergency, whether that's using text messages, posting information on the practice website, using social media, or the patient portal. So all of these things, I think we developed both for families, but also for practices and other healthcare professionals to share with families and assist them planning for emergencies and disasters. Finally, there's one other document that I'd like to share. It's our local resource guide. One of the things we heard from families is, and also from pediatric practices and other healthcare professionals, is that many people really don't know what emergency resources exist in their own communities. And they wanted just a simple one-page summary of who to call for what types of things. So using the city of Philadelphia as an example, we put together just a one-page local resource guide that has everything from how to reach the local 911 call center, including computer-aided dispatch and pre-registering with those kinds of systems before disasters, to how to sign up for text alerts from your local emergency management agency, how to reach your utility company if you were to lose power, how to reach health and human service agencies in an urgent fashion. Many jurisdictions now have a 211 service, which is often operated with the United Way. Many jurisdictions have the equivalent of 311, which is non-urgent requests for assistance, poison control. And then we provided here, again, using Philadelphia as an example, with contact information for the local health department, state health department, CDC, et cetera. And we hope that pediatric practices and other healthcare professionals can use a form like this, and left a space again for pediatric practices to insert the name of their practice and other key contact information that they want families to have. So that's a set of tools that we developed for families that we hope are useful for all families. And we also hope that healthcare professionals, as well as first responders and other folks who care for families with special healthcare challenges, can take advantage of to help families get ready for disasters. So we believe that this information is helpful for families, but we also developed all of these tools with the idea that first responders and other health professionals, including pediatric practices, would use them when they interact with families and share them and help them prepare for disasters. And if you'd like to find them, they're located on the website for the Center for Public Health Readiness and Communication, which you can see here. And you can scroll down and look for Disaster Preparedness Toolkit for families with special healthcare challenges. And you should be able to download each of the tools that I've just described. Thank you again for the opportunity to share this information with you.
Thanks so much. So Dr. Chernak, as we're transitioning up the next slide, so you know, she, the CDC gave her a literacy award, and the team for these tools. And I can say that I personally use them, and they're part of what we're doing with our home assessment. So we'll make sure, I think a lot of stuff in the chat, we'll make sure you have all of these resources in the toolkit as well. And so sort of thinking about, you know, preparing some of these, the photo there on the right actually comes from Dr. Chernak's toolkit, but also remember what Kelly really highlighted so poignantly and beautifully early on. It's just really helping our children and youth with medical complexity, you know, be prepared, kind of that upstream. So having some level, whether it's a text board or a visual aid, and just having some level of, as much as we can, having a predictability, a preparedness for our youth so that they can make some of that emergency a little less traumatizing. And so, you know, as we think about the toolkit that Dr. Chernak mentioned, totally recommend kind of looking at, we tried to put all this on one slide. So there's some checklists there. There's some, you know, I think one of the things, the local resource guide that we have there is geared towards Philadelphia, but, you know, our goal would be to kind of work on this so that we could have something, you know, you could sort of use when we created these, sort of have some of the categories be something that we could fill in with the local area. So the local resource guide to sort of be reproducible. And that's something that we're thinking about and looking at in Pennsylvania. But just this idea of some of these checklists are things that we hope will be useful to you.